Hi, have you got clear, set goals for your breastfeeding journey? If you've had a new baby and you're trying to breastfeed now and you're trying to decide how long you should or what most people do, this video is for you. I'm Nana G, and I have been helping women just like you get clear goals that they can reach based on science and based on my more than 40 years of doing lactation and helping moms start feeding their babies and reaching success. So, the first goal when I go in and see clients, and I still work in a very large hospital and see many clients a day, is to talk about the short-term goal, because when you take the baby to the pediatrician visit at 2 weeks, the pediatrician wants to see that the baby has returned to birth weight. So, first of all, you can expect that all babies are going to lose some weight. If you're still in the hospital watching this, the normal expectation is maybe somewhere between 5 is an average, 10 is an alarm. So if you're doing anywhere between 3 to 7%, you're doing great. That means that your baby is getting some nutrition, even though you may not see very much and only see little drops of colostrum. If your baby is not losing weight in a large amount, it means that it's getting some nutrition. Now, we're expecting in those first couple of days that the baby is going to be peeing at least once for each day old that it is. So day 1, 1 pee, day 2, 2 pees, day 5, 5 pees. And that the baby's going to have poops or bowel movements at least once a day, but probably more than that. That is the answer to the question of how do I know if my baby's getting anything? Is my baby getting enough? If the baby is pooping and peeing, and those numbers, at least 1 poop a day, at least 1 pee for each day old it is, and you're monitoring that for the first 7 days, then your breast milk is getting in and coming out. The second thing that you're going to look for is after the baby feeds, can the baby go to sleep? That's another short-term goal. If the baby is still putting his hands to his mouth and looking, and you have to put a pacifier right in right away that can't soothe the baby's probably still a little hungry. And it could be that your milk is in, but you're not getting the baby at the right place. If you're experiencing that, please go back and watch my video on how to latch the baby, because often what I find is moms who have a lot of milk and babies who are losing weight, it's that the baby is not getting its mouth in the right place and is therefore not transferring the milk from mom's breast to the baby where it can gain the weight. So please go and watch that video. It will help you. But this one is about setting goals. So the goal that you want to have is to feed the baby at the max 3 hours. At no more than 3 hours, you have to wake the baby and feed the baby if you're breastfeeding, because the baby doesn't have any stores of fat to hold it. It has a very tiny stomach the first day, about 5 millimeters, the size of a marble. And with it pooping and peeing, it's really emptying. So 3 hours is the most it can go. That's 3 hours a day and 3 hours at night. So if you've got the baby swaddled and the baby's all feeling like it's inside and it doesn't know it's hungry, you've got to wake the baby up and you've got to feed it if it's still sleeping at 3 hours. But most likely you would have gotten alarm from the baby. So the goal is to feed the baby as often on demand, maybe 1.5, maybe 2, but certainly not more than 3 hours the first 2 weeks. And this is a critical period because during this first 2 weeks, your body is determining how much milk your baby needs. Somebody else's baby might need more, your baby might need less. So every time your baby's hungry, it sends a message to your brain to release hormones to send milk to your breast. And so it's really a good thing in those first 2 weeks that your body is producing the milk that your baby needs to gain weight, because the pediatrician is looking to see that your baby at 2 weeks old would have returned to birth weight. So that is your first goal. getting the baby to return to birth weight. The next goal that you may determine is how long do you want to breastfeed your baby? And most people just want to breastfeed, but they really haven't thought about how long. And they've heard maybe 6 months, maybe a year. Maybe they had a sister-in-law who breastfed for 2 years and they want to do that. So people have different goals. The American Academy of Pediatrics recommends that you breastfeed exclusively. That means no water, no juice, just breast milk for the first 6 months of the baby's life. So for the first 2 weeks, you're establishing your supply. If you breastfeed regularly every time the baby's hungry in those first 2 weeks, you will create a good supply of milk and enough to really usually go through the first 6 months. If you don't, if you're having problems with supply, and we'll talk about supply in another video and some of the reasons you might have it, this is a definite reason to see a lactation consultant and see what's going on. And here I'd like to interject that lactation consultant services are generally available through your insurance plan. I tell all of my moms, make sure to schedule a lactation consultant visit somewhere between day 5 and 10, even if you think everything is going great, because chances are you've not seen too many people breastfeed, you really don't know, and most things that you care about, you'd be willing to have someone spot check you, a coach teach you, a driver instructor train you. So why not get that benefit that your insurance company is paying for? When you don't do that, it's like leaving money on the table. Why do that? Get the help in the beginning. But also, if your milk's not coming in properly, she or he can give you the assistance that you need. So for 6 months, you're going to exclusively breastfeed the baby, and you're going to have enough milk to do that, and the baby will continue to gain weight. Now, at about 5.5 to 6 months, your baby's now crawling and moving around, and chances are beginning to take some food from your plate because it's sitting in your lap, and it wants to start eating solids. And that's when you introduce solid foods and your breastfeeding journey gets a little shorter because you don't have to feed as often because you're now giving some solid foods. Some people opt and think, well, now is the time to stop, and you may think that too, but here are some things to consider. When you get to 6 months of breastfeeding, the breast milk composition actually changes. Unlike formula that's one steady thing all the way through, your breast milk is going to adapt to where your baby is in his or her life journey. At 6 months, the baby is moving around, touching more things, and therefore exposed to more germs as it's crawling on the floor. And so your breast milk, miraculously, starts to produce more immune properties. Depending on the time of year, at 6 months, if you have your baby in the summer, you may be in the middle now of flu and cold season. And I tell moms, why not try and go for at least 9 months just to get that immune property in? And if you've taken the flu vaccine, then your baby, through getting your breast milk, is also getting that immunity. So timing and when you stop is important. Of course, these that I'm giving you are guidelines. You're going to breastfeed for as long as it works for you, depending on whether you've gone back to work and just all of the factors that are personal for your life. But what I want to give you in this video is some things to consider about when you might do that. And so the first goal is to make it to at least 6 to 8 or 9 months. Continuing to breastfeed into the 1 year period, which the Academy of Pediatrics does recommend 1 year of breastfeeding. 6 months of exclusive breastfeeding, then introducing foods to supplement at 6 months, and then continuing for 1 year because of the added bonuses that are in breast milk. There's an increase in the fat and protein in breast milk at this point, and a decrease in the carbs because your baby is now taking other foods that may have carbs. It also has some enzymes that change to help with digestion. So there are some many wonderful things happening in that breast milk if you make it out to a year. I want to end this video by saying any amount of breast milk that you're able to give, even if it's colostrum in the hospital, is awesome. That this is a very personal decision and there are lots of benefits. They're going to be in the benefits video. But this also depends on your lifestyle and what works for you. But if you haven't set specific goals and you wanted some feedback on guidelines that are out there and kind of the reasons why those guidelines are in place, I hope that this video has been a help for you. So again, a review. Short-term goal, 2 weeks. Breastfeed all through the night, all during the day, when the baby is hungry and showing feeding cues, so that your milk supply will come in an adequate amount so that you will be able to breastfeed if you choose for the 6 months. And when I say breastfeed, I'm also talking about pumping the milk and putting it in a bottle and giving it to the baby. We're really talking about providing breast milk to the baby rather than always putting the baby at the breast, because the baby will get those benefits from getting your milk. And then the second goal, go to 6 months. Third goal, if you can, go to a year because of all the things that are happening and what the baby may be exposed to in that latter 6 months when you're transitioning to an alternative to your breast milk. I hope this information has been helpful. If you have any comments or suggestions to others who may be watching the channel, please leave a comment below. Share this video with others that you know who may need some guidance on making their plan. When you have a plan, it's much easier. And also view my breastfeeding guide to a proper mindset on breastfeeding, because it's always important to have information that helps you enjoy this journey. Breastfeeding is really about you. We know that you're going to give your baby the best, that you're not going to let your baby starve. And I am a believer in helping moms and dads come up with the plan that works best for their life so that you can feel good about your decisions and how you have done this thing. It's a wonderful thing. It's not the only thing. The important thing is that you get the information so that you can make the decision that's right for you. That's why I'm here, to give you experience-based, evidence-based information to make it easier for you. I hope that this video has done that, and I'll see you in the next one.